have obsessive-compulsive disorder, or OCD. 1 in 40 children and 1 in 100 adults in the United States are diagnosed with OCD each year. It is characterized by obsessions and compulsions that take up to at least an hour a day, but usually longer, and they have to cause significant distress to be properly diagnosed with the disease.
Maybe I do have OCD. How do I know for sure?
Even though OCD is accepted as an illness with biological roots, it can be diagnosed using blood tests, x-rays, or other medical tests. You would have to be diagnosed by a psychiatrist, a psychologist, or other medical professional using a series of questions based upon the nature, duration, and severity of your symptoms. Double checking the front door a few times or washing your hands more than once is considered obsessive-compulsive disorder. We all have little obsessions and compulsions, but it truly becomes a disorder when it starts impacting your life in a big way. If you check the door so many times, you become late for work. Or if you wash your hands so much, it starts to hurt and takes time out of your day. If you can't hug your loved ones because you can't get the thought of their germs out of your head, that's when it becomes a disorder.
Does this mean I'm going crazy?
No. Although you are faced with obsessive thoughts and compulsive behaviors, you are not going crazy. Many people live their lives with this disorder every day and are happy with the life they live. Some of them you wouldn't even know they were diagnosed.
Really? Like who? Anyone I would know of?
David Beckham.
Howie Mandel. Leonardo DiCaprio.
So everyone's case is different. How did I get OCD? Is it because I didn't eat my vegetables when my mom told me to?
No. Although researchers have found through many tests that certain areas of the brain function differently in patients with OCD compared to those who don't have it, researchers have not found any definitive cause or causes. It is believed that OCD is likely the result of a combination of neurological, genetic, behavioral, cognitive, and environmental factors.
Wow, all those people go through the same things I do. But if they're so rich, can't they afford treatment?
There is no cure at this time because scientists still are not sure exactly what causes OCD, and everyone's case is different. But treatments that have made life a lot easier for patients are cognitive behavioral therapy and medications. Cognitive behavioral therapy focuses on the catastrophic thoughts and exaggerated sense of responsibility you feel. A huge part of this type of therapy is teaching patients healthy and effective ways of responding to obsessive thoughts without resorting to compulsive behavior, and repeated exposure to the source of your obsession. Medication may also be used, but medications alone rarely fix the problem. The Obsessive-Compulsive Cognitions Working Group has identified 6 types of dysfunctional beliefs associated with OCD.
Inflated responsibility,
which is a belief that one has the ability to cause or prevent negative outcomes.
Overimportance of thoughts,
which is the belief that having a bad thought can influence the probability of the occurrence of a negative event.
Overestimation of threats,
which is a belief that negative events are very probable and they will be particularly bad.
Control of thoughts,
which is a belief that it is both essential and possible to have total control over one's thoughts.
Intolerance for uncertainty,
which is a belief that it is essential and possible to know, without a doubt, that negative events won't happen.
Perfectionism,
which is a belief that one cannot make mistakes and that imperfection is unacceptable.